Kia ora, my name is Deb Somerville. I'm the Associate Head of Postgrad Nursing. I am based at Mataranga Horoa, which is the Faculty of Medical Health Sciences at the University of Auckland, Waipapa, Taumata Row. So why do postgraduate nursing? There are many reasons why you might want to look at postgraduate nursing as part of your career pathway once you've become a registered nurse. Most people will enrol into a postgrad cert to begin with, and that kind of gets you started on the journey. You can stop at a postgrad cert, or you can move on to a postgraduate diploma. You can stop at the postgraduate diploma, or you can move on to the full Master of Nursing. Any postgraduate study is going to take you places in nursing, because as you move through a nursing pathway, you'll realise that by studying further, you'll open up a whole lot of different places that you can go in nursing. So, for example, you might have aspirations to be a charge nurse, so you might look at taking leadership courses within the postgrad pathway. You might want to be a nurse educator or come across to the university and teach, in which case you might look at an educational pathway. You might think, I want to stay clinical. And with clinical nursing, you've got many different aspects of postgraduate study that you can do, including going down a pathway to be a nurse practitioner or to get prescribing rights as a registered nurse prescriber. But you might be someone that just wants to enhance your clinical practice, learn more, understand more, and as a result, perhaps deliver better patient care. So postgraduate nursing has somewhere in the breadth of 50 different courses that you can choose from, many of which are really clinically based. So you might work, for example, in the emergency department. You could start off your postgraduate pathway with an assessment course, so really engage how to use your stethoscope on your patients, how to do a full neurological exam, how to look at diagnostic tests and interpret them, to an emergency course in itself, a specialty course. From there you could choose a number of different directions in nursing. So what's the rationale? It engages practice, it opens up many doors which you won't have without doing further study. So it's for any registered nurse, and you can start as a new graduate, although maybe that new grad year is a year to develop as a registered nurse, and in your second year start thinking about what else can I learn that's going to actually move my practice forward. So as I mentioned, most people will enrol first into a postgraduate certificate, and that's 60 points. Our courses are 30 points, so that's two 30-point courses, and at the end of that you have your postgrad cert. Some nurses will stop there and they're happy with the postgrad cert, and that's fantastic. Otherwise you can move on to a postgrad diploma, and you've actually got 5 years to make that choice, so you can have some time off and then back into your postgrad cert for a further 60 points or another two 30-point courses. At this stage, you can keep everything really general. You can pick and choose from that breadth of papers that I mentioned earlier. So you might pick an education course, you might work in palliative care and pick a cancer course or a palliative course. You might pick education, leadership, research, evidence-based, so many different choices that you can make that 120-point postgrad dip with. A lot of people will stop at the postgrad dip, have a rest. Remember, you're a part-time student and sometimes a full-time registered nurse, so it's about getting the mix right and the balance right. We don't recommend going and doing full-time postgraduate study unless you're not working clinically. Most of our courses actually require you to be in a clinical position. So part-time courses, one course at the most per semester, will see you sort of through that journey. As I said, at the end of the postgrad dip, you can stop or you can start back in the Master of Nursing, but you've got any length of time to do that. The Master of Nursing pathway, again, has a few more regulations to it than the diploma in terms of there's some things you have to do. So you have to incorporate a small piece of research. Our courses at the University of Auckland have a whole mix, a mode of delivery. So we have most of our courses are face-to-face. You come into class for the entire study day. Often the days are done in blocks, and there's usually between 4 and 6 face-to-face study days per course. Since COVID though, we've started to look a little bit more at online delivery, and some of our courses are entirely offered online, which is really appealing if you're coming perhaps from out of Auckland and you don't have that extra time to actually come up to Auckland. And we also offer blended delivery, which means that some of the courses face-to-face, so maybe 2 or 3 days, you come into Auckland for the study day, and the rest of the delivery is done online through tutorials, Zoom, and online learning packages. So there's a number of different ways you can learn. The last mode of delivery we've got actually is running one of our courses face-to-face, and the option is that you can run it in its own cohort as an online mode as well. So the flexibility is definitely there. In terms of costs, postgrad courses are expensive, so most of our nurses that come through, over 90%, would be completely funded from their clinical areas where they work, which obviously makes a big difference. The benefits are amazing, and each year we have about 3,000 registered nurses that come through postgraduate study, and as a result, those nurses are moving into areas that they really want to work in, areas that make them feel passionate and feel that they're actually doing something different within their nursing. So in terms of shaping the future, I think all registered nurses, regardless of postgraduate study, have that ability to make change in health. I think though, if you engage in postgraduate study, it opens up a world that broadens how you think, and as a result, I think it develops our future leaders. So the nurse practitioner pathway is becoming more and more popular as we gain more nurse practitioners in New Zealand. It's quite a prescribed pathway, which means you have to pick up certain courses along the way, and it takes you through a taught master's. So for example, you would start with usually the assessment course and a pathophysiology course for your postgrad cert. Then you would have kind of what's called a free paper, which means you could pick it from your clinical area or not. And you usually at that stage do the evidence-based course. When you move into the 120-point masters, you're left with a prescribing course and the small research topic, which is the compulsory part of the masters taught. Then you continue on, and your last 60 points are actually the nurse practitioner practicums. It's not just following an academic pathway, it's also following a clinical pathway. It's a fantastic journey, and for many nurses, they would see that as the final clinical place where they want to be.
Kia ora, my name is Rachel Park, and I'm the Associate Head for Postgraduate Research in the School of Nursing based at the Mātauranga Hauora Faculty of Medical and Health Sciences, University of Auckland, Waipapa Taumata Row. So I'm here today to convince you that undertaking your Masters of Nursing via a research pathway is the ideal option for you. And so what I'd like to do is tell you a little bit about the pathway and what is involved and how we can help you achieve your Masters of Nursing. So why do research? Well, I guess I'm a little bit biased because I think that nurses make amazing researchers. I think we have this natural curiosity to learn and to see where we can improve on things or where we can develop new skills, new technologies in order to improve outcomes for our patients or for our colleagues or the health system in general. So you can do this in a number of ways. What we do is we encourage you to undertake a research methods paper, either as part of your postgraduate diploma or within the actual Masters of Nursing in the last 120 points. And that will then also influence which other papers you do, whether you undertake a 90-point research portfolio or a 120-point research portfolio or thesis to use up the rest of your points. Now, the idea of this is that it is a coherent piece of research that you design, that you undertake. You might collect some data along the way through either interviews with people or through undertaking data analysis of some numbers, some quantitative data, and then writing it all up and presenting it along the way. So there are a number of options there that you can use to do this. Along the way, we will engage you with some supervisors, either one or two supervisors. You might also have clinical advisors from your area that you can utilise to help you undertake your research. And these people are there to help you along the way to know what to do, but also to support you to get across the line at the end with some really useful, important research that contributes to the knowledge base. In terms of who this is for anyone. So we have a range of people who come every year to do these papers. They might be clinical nurses based in hospitals, they might be in the community, mental health, community health, all sorts of areas. It really isn't restricted at all. One of the things that you might like to consider is scholarship opportunities as well. We have a number through the university and through the School of Nursing that we can talk to you about if you decide to head down this pathway. The benefits of undertaking a research pathway long term are around career development, in particular in the workplace, but also academically. You know, this could lead to you teaching at the university perhaps, or undertaking more research. It may even lead to you going on and undertaking doctoral study as well. And so planning ahead now, if that is on your radar, if you're thinking of doing a PhD or the Doctor of Health Science program, undertaking the research masters now sets you up for that really well.